YouTube channel that I'll post my recordings to for you guys. And then each week I'll post the recording link to my YouTube page. Okay. That's the easiest way. And there's old lectures on there if you want to go back through and listen to those as well. That might be another beneficial way for you guys to study. Okay. When the other professors do their exam reviews, those recordings, as long as I get them, as soon as I get them, I usually post them. So you guys can look at those too. Okay.
Professor, there was one question where one of the options had like it was like on the seed, and then it had like the period and then like the answer.
Uh-huh. Yeah, I know. I noticed that too. And that wasn't even the answer that was keyed. So, oh, hang on. Um, so yeah, so that will be looked at. Okay. Okay, let me share my screen again here. It didn't work the first time. Okay. You guys see my PowerPoint screen now? Okay, thank you. Okay. Okay, so, oh, sorry, I skipped ahead here. Okay, so this week will be chapters 31, 32, and 33. So we'll talk about infants, toddlers, and preschoolers more specifically, okay? So, this is kind of what we just talked about, is tripling birth weight by a year of age, doubling by 6 months of age, okay? Height is about 1 inch per the first 6 months. So they'll grow an inch per month for the first 6 months. And then the growth kind of starts to slow down a little bit. The first year of life, babies should gain about 5 to 7 ounces per week. Okay. If they're not gaining that, then of course you want to figure out why that is. And a lot of times it may be they have some sort of nutritional deficiency, like a metabolic issue, or parents aren't mixing the formula correctly, or they're not eating enough, or they're not nursing well. I mean, there's a lot of different factors that can go into poor weight gain and poor growth. And then you, just as a peds nurse, will have to kind of try to figure out the potential causes of that growth issue. Sometimes babies will be admitted to the hospital to see if they're able to gain weight in the hospital setting, when it's really controlled, when nurses can watch parents mix the formula and see how much baby's taking. And then, check their weight naked with the same scale consistently. And, obviously, if babies don't gain in that setting, there's something going on. Usually it's a metabolic issue. But if they do gain weight and then they go home and then they continue to not prosper, then, you worry about not getting fed or kind of a poor environment. Okay. Or parents not being able to afford the formula and they ran out of their, WIC coverage of their formula. Stuff like that happens as well. So biological development, of course, during infancy, so that's up until the first year, is considered infancy. Okay, so birth to 12 months, okay, is infancy. After that, then they're considered toddlers. Your central nervous system is the fastest growing system during infancy. Okay. Like I said, making sure nutrition is adequate is going to be your most important priority in infancy. because a lot of times if they don't get those kind of foundation blocks with their growth, then it's very difficult to get that caught up. Okay. So as they become older, you're going to see their heart rate slowing down, their respiratory rate slowing down. Oh, that's the other thing that's in the week 1 discussion is your normal pediatric vital signs. So make sure you guys look at that too. Okay. So initially, they'll have a faster heart rate, they'll have faster respiratory rate. And then as they get closer, to a couple months old, that will start to slowly slow down over the time period from throughout infancy. Okay. So the fetal hemoglobin is present until about 5 months of age. And then what happens is between 3 and 6 months, kids become anemic. And this is a normal physiological process. So parents don't need to freak out about that their kiddo's hemoglobin is dropping around that time. It's pretty much expected. Okay. So over the first few months, because that hemoglobin is kind of dropping, right? They're getting their iron stores from mom. Okay, so it'd be important that mom is making sure she's getting plenty of iron in her diet and or supplementation. Okay. Head growth, very rapid the first 6 months, and then it kind of slows down. The posterior fontanelle, so the opening or the fontanelle in the back closes by 6 to 8 weeks of age, and then the anterior fontanelle close between 12 to 18 months on average, 14 to 15 months. Okay. Babies are also increasing their auditory and visual acuity and perception during this time. So initially, they have a very difficult time seeing, kind of looks blurry and it's black and white. And then as they mature, that develops. Okay. Babies have mom's immunity the first few months, especially the first, I would say 6 to 8 weeks. Now, if they're breastfeeding, then that immunity can kind of continue to flow over to babies. But if they are formula feeding, most of the time around 3 months, the coverage from mom kind of starts to wean away. Okay. Their immune system should be working on its own to respond to infections and vaccines, right? That's the process of giving us giving them the vaccine, so that way they can make an immune response to the vaccine. That should be happening by about 9 months of age. Okay. So 6 to 8 weeks of age, that antigen antibody response to the vaccine capability piece of the immune system is mature. Okay. So that's why we start vaccines at 2 months of age. Okay. IgA, so that's an immune globulin that protects their GI tract during infancy. That kind of works as a form of their immune system until their immune system starts functioning on its own. Vernix caseosa, so that's that kind of white, cheesy sort of appearing skin protectant. Okay, so a lot of times in the skin folds is where you see it most. It helps to prevent infection of their skin. Okay, so a lot of times parents will say, should we wipe that all out? And you can tell them that, they can just kind of leave it. And as they get more baths, it will slowly, disappear over time. Thermoregulation. So at birth, the infant needs to be dried, of course, right away. That's what you'll see happen in your OB rotations, or you probably did see happen in your OB rotations. They dry that baby off, get all of the gunk off of them, and then put them under a little heat lamp so that way they can stay nice and warm, or put them on mom or dad's chest so that way they can start kind of working on that thermal regulation. Okay. As they get older, just like with all body systems, it becomes more efficient. Okay. Babies will shiver if they are cold. So obviously, if you notice that, that would be really concerning with an infant, especially a newer born infant or an early born infant. They cannot regulate their temperature if they're preterm as well as a full term baby. So that's where you see a lot of those NICU babies in their incubators. Okay. Over the first 6 months, they're going to start to increase that fat tissue or that adipose tissue to help with preventing heat loss. Okay. Blood volume shifts from water to then to the extracellular fluid. Okay. At birth, that occurs. Okay. So that's predisposing that infant to dehydration happening a lot more quickly. Okay. All right. So fine motor development. Like I said, there is a handout from week 2 under that announcement with fine motor and gross motor developmental milestones that you guys would probably find helpful studying. Okay. So prehension, this is just grasping objects. This occurs around 2 to 3 months. Okay. Now, the palmar grasp, that's kind of, you can see infants, parents put their finger in the infant's hand, and what happens? They close their hand around it. That's just a reflex. Now, palmar grasp is when they get to be 2 to 3 months and they're actually purposefully grasping. Okay. Parents will think it's really cute that their baby's holding their finger, but it's purely just a reflex at that point. Okay. Transferring objects between hands, that's around 7 months. The pincer grasp, so that's going to be pointer finger and thumb, really efficient pincer grasp. That should be accomplished by 10 months of age. Okay. Taking things out of a container, that's around 11 months. Building 2 blocks on top of each other, that should be around a year. Okay. Okay. Palmar grasp. What age was that? You guys can just unmute.
2 to 3 months.
Perfect. What about pincer grasp?
10 months.
10 months. Yep. Good. What about transferring objects?
7 months.
Yep. Good. And then removing things from containers?
11 months.
Yep. 11. And then building a tower of 2 blocks?
1 year.
1 year.
A year. Yep. Good. Perfect. All right. Gross motor development. So head control. Head control should start and continue to improve. So most babies should have some form of head control about, I would say, 2 months, but they should have really good head control where their body, just like this picture. So this is probably a 2-month baby. Okay. So their head's still kind of lagging. This is called head lag. Okay. So this would be pretty typical. Now, if this was a 4-month-old, then you would get really concerned. Okay, because 4-month-olds should be following their head along with their body as they're sitting up. Okay, so this would be considered head lag in a 4-month-old. So infants should have good head control by 4 months of age. If they do not have that, so if any of these things aren't accomplished by, the latest time frame on the range, then these kids should be getting interventions, whether it's physical therapy, occupational therapy, ensuring that they're growing appropriately and that they don't have some developmental delay causing them to be delayed on their development. Okay. So the sooner you can identify these delays and the sooner you can get them services, the better outcome usually for the infant. Okay. Baby should roll over, belly to back. first, typically. Not all of them go in that range, but by 5 months of age. 6 months, back to belly. Okay. So they should be rolling both ways by 6 months of age. Sitting, now that's sitting independently, not using their hands to hold them up, by 8 months. Okay. And then they should go from lying to sitting up themselves by 10 months. Okay. Tummy time is really beneficial for good head control, for encouraging babies to roll over, and for good core development. So that way they can start with their sitting and things. Okay. So talking with parents about tummy time, even at their newborn or 2-week appointment. Okay. They can do short bits of tummy time with parents right there. Okay. So locomotion, their movement. So cephalocaudal is typically the direction of development. So head to tail is what cephalocaudal means. So usually head to legs. Okay. So they should be crawling. So they should go from rolling, right? By 6 months, both ways. Crawling between 6 and 7 months. Creeping, which means like walking along furniture, by 9 months. Walking with assistance, so parents holding onto their hands, helping them walk, at 11 months, and walking alone by 1 year. Okay. Now, 1 year, I would say for walking is the average time frame. You get concerned if babies are not walking by 15 months. Okay. That would be considered delayed. Okay. So nutrition, the first 6 months of life is going to be formula or breast milk. Okay, that should be it for the first 6 months. That's what's recommended by the AAP. Now, will some people do rice cereal, oatmeals, things like that? Sure, they will. But what's recommended and what you guys need to know is first 6 months, breastfeeding, formula, express breast milk. Okay, that's it. Obviously breastfeeding is recommended for at least the first 6 months, mostly for babies to get those antibodies from mom's breast milk, and continue to support their immune system. Not every mom can do that, and that is totally fine. In those cases, those babies will either get donor breast milk or formula. Okay. At 6 months is when foods like purees and table foods can be introduced. Okay. You do not have to start with rice cereals and oatmeals. That's kind of an old recommendation. You do not have to only do purees right away. You can do bigger, it sounds kind of counterintuitive, but bigger strips of table foods. Okay, if parents are comfortable with doing that. If parents want to just start with purees, that's totally fine too. Okay. Most babies should nurse on demand. So that means whenever they feel hungry, they should nurse. And on average, about 8 to 10 minutes. I usually tell parents no longer than 30 minutes total on each breast, because then they're working too hard. And then they're not going to get enough calories from that. Okay. So frequent waits are going to be happening with early infancy. So these babies will be seen usually within the first 3 to 5 days on average of life after discharge. So that'll be a checkup with their pediatrician or their peds provider. So you guys as nurses, if you were in a clinic setting, you would be checking their weight and their height and their, weight and length and head circumference, and doing some basic vitals, checking their temps, all of that. Making sure that they're growing like they should be. Okay. So a typical weight loss that's acceptable is less than 10% of birth weight. Okay. So, or up to 10% of birth weight lost. Okay. The goal is that all babies regain their birth weight by 2 weeks. Okay. They're having 6 to 8 wet diapers after they are 6 days old. Okay. Until they're 6 days old, it's 1 diaper a day per age old they are. Does that make sense? So like on day 1, babies should have 1 wet diaper. Day 2, 2 wet diapers. Day 3, 3 wet diapers. Day 4, 4 wet diapers. Day 5, 5. And then from there on out, 6 to 8 wet diapers. If they're not having 6 to 8 wet diapers a day, then you get concerned that they're getting dehydrated or they're not getting enough food. Okay. Like I said, a ½ ounce per day over the first 2 months of life, which equals out to about 5 to 7 ounces a week on average. Okay. Breastfed babies should get vitamin D supplementation, 400 IU daily. Okay. If they're more formula fed than they are breastfed, then they do not have to do the vitamin D supplementation because that is in formula. Okay. Okay. All right. So the digestive system. Now, if any of you have not seen a normal breastfed baby poop, this is what it looks like. You're welcome for the picture. Okay, so this parents will get so concerned about baby's poop, especially if they haven't had a breastfed baby before, because it goes from that dark meconium thick tar to this yellow kind of seedy liquid mush. Okay, so parents get concerned about that. Now, usually what I tell parents is that's just their digestive system processing essentially more of the nutrients. That's why they have poops that look like that. Now, this stool, you can see there's some kind of specks of mucousy looking blood. So, one of the biggest causes of mucousy looking blood in stools is a cow's milk protein intolerance. Okay. Doesn't mean that they have a dairy allergy. Okay. They just can't tolerate the cow's milk protein. This is pretty common in infancy and usually resolves by for sure by a year, usually in most kids. Some kids that might continue into toddlerhood, where whenever they have milk or dairy products, they have kind of that mucousy blood streak stools. Okay, so how you stop that is eliminate dairy from their diet. So if they're on a dairy-based formula, you switch them to a soy formula, or you switch them to something like Nutramigen or Alimentum. Okay, if mom is breastfeeding or they're getting donor milk, then that donor or mom have to eliminate dairy from their diet. Okay, so the reason why is that yellow color usually is because their GI system, their liver is so immature. So that's why it's that yellow at first. Okay. Okay, so the second 6 months of life, this is where we introduce, like I said, the purees or solid foods. Okay. Initially, the first at 6 months and 7 months, it's just experimental play, essentially. They're not going to get a lot of nutrition from it. They are not, going to be replacing any bottles or nursing that they're doing in the first couple of months. Parents can do one meal once a day for the first, so during 6 months and 7 months. Okay. Then at 8 months and 9 months, you'll start seeing that increase to 2 meals a day. Okay. And then 9 months, so between 9 and 10 months is when they'll go to 3 meals a day. Okay. And that's when you'll see kind of a dip a little bit. That seems pretty appropriate in their milk intake, whether that's formula milk or breast milk. Okay. So that dip kind of happens between 10 to 11 months in the amount of formula or breast milk that they're taking. Okay. So you're slowly introducing foods. You do not have to introduce one new food at a time. That's kind of an old recommendation as well. You can do high allergen foods earlier on. So eggs, peanut butter, like in the form of like peanut butter powder or peanut butter watered down. You can introduce that. Soy, let's see what else is high allergen. Fish, shellfish, all that. Okay. So that can start being introduced at 6 months. It used to be that they say wait on that, but they figured out that if that is introduced earlier and more regularly throughout kiddos' diets, they're less likely to have allergies to those. Okay. Because it used to be like everyone was like, avoid peanut butter until they're a year. Don't do any of that. Then we started to see a lot of peanut allergies. And in Israel, they do, you know, like the little puffs, the cereal puffs, mostly out of rice or grains. They do those in Israel, but they are peanut powder based. And they had almost no peanut allergies when we were having a lot of peanut allergies. And they were just giving those obviously earlier to kids than we were here in the United States. So after doing some research, AAP changed that recommendation. Now, in doing high allergen foods, you want to do one of those a week. Okay. You don't want to do multiple high allergen foods at once. Okay. Because obviously, if you're doing multiple all at the same time, you don't know which caused the allergy potentially. Okay. You do not have to do vegetables first. You do not have to do fruits first. So parents can kind of just choose. You can do mixtures of things. Okay. That's all acceptable now. Okay. So allergies versus intolerances. You will see this a lot. Okay. Patients, I'm sure adult patients have told you that they have a food allergy, and you really know, okay, diarrhea to food is not an allergy, it's an intolerance, right? So there's that difference there. Okay. Now, if it is an immediate GI, severe vomiting, severe diarrhea right away, that may be kind of more classic of an allergy. But of course, those more true allergic signs are going to be rashes like hives, facial swelling, troubles breathing, cough, cough, cough. Okay, those anaphylactic signs. That's going to be an allergen. Okay. Any questions about the differences between intolerances and allergies? I know a lot of times those kind of get confused. No? And I also forgot to tell you guys, if you have questions at any point, you can unmute and just ask me to clarify more. Okay. Okay. So if kids have true food allergies, they will desensitize them. Okay. So they will give them in a allergy office. Say the kiddo has a peanut allergy. They will, in an allergy office setting, give them a teeny amount of peanut. Okay. Wait 15 minutes. Watch for any signs of anaphylaxis or symptoms. And then they will give them a little bit more. Okay. Then they'll continue to do that until they're desensitized. So until they no longer have that allergy and parents no longer have to avoid that food. Now, if parents don't go for the desensitization process, they just want to avoid it, then that's an option as well, if they have a food allergy. Now, of course, they don't have to completely avoid things. If they have an intolerance, just know that they may have, you know, diarrhea or upset stomach from that. Okay. Now, atopy or atopic dermatitis, that's eczema, right? That's what's happening here in these pictures. Okay, different signs of eczema. Eczema almost always goes hand in hand with allergies. So if, and a lot of times it's flared up from like milk or dairy. Dairy seems to cause kind of more of an allergic flare up of skin. Okay. So you will see eczema Most kids who have eczema also will have seasonal allergies or allergic rhinitis, so that runny nose, and asthma. Okay. It's called the allergic triad. Those three things kind of go together. So a lot of times if kids have one and they don't manage their allergies, say, well, then a lot of times they progress to having asthma. And then a lot of times they even progress further to having eczema or vice versa. Okay. So if you're noticing kids having eczema, it would be important to have them see an allergist. Figure out what's causing their eczema to flare up. So that way it can be maintained. Okay. Okay, sleep and activity. Babies, sleep on their backs. No sleeping in rock and plays or swings. Okay. Car seats that are not installed. Okay. On their back in their own bed. Okay. That's what's recommended. Okay. So most babies between 3 and 4 months should be getting about 9 to 11 hours of sleep. Who had a baby that didn't do that? Me. I'm sure you guys have experienced that too. So it doesn't mean that there's an issue. It's just most of those babies have that nocturnal sleep cycle developed between 3 and 4 months. So they're able to sleep longer stints and not have to wake to eat as often. Now, you will see breastfed babies. They're going to wake more often because that breast milk doesn't fill them quite as much as formula kind of sits in their bellies. Okay. But like I said, sleep patterns, like across the board on most infants, it can be all over the place. They'll go through sleep regressions if they're teething or if they're sick. Like there's so many variations, but on average, their body, they should be able to between 3 and 4 months sleep for 9 to 11 hours. Okay. Napping, usually they're going to take, initially multiple naps throughout the day. They might be multiple 30-minute naps a day. They might be 2-hour naps multiple times a day. As they get older, they're going to have more wake periods. Okay, so they're going to be more awake throughout the day. Walkers, swings, playpens, like the like little play areas where they're kind of fenced in, those aren't necessary. They're not recommended by the AAP just because of potential risk of injuries with those, like with walkers. If parents look away for 5 seconds and they have stairs, baby could walk down the stairs and, fall out. Also, the thing with walkers that you get concerned about is tiptoe walking, if their feet can't be flat in the walker on the ground. So you'll see a lot of babies kind of tiptoe walk after they've utilized walkers often. Okay. Questions on sleep? No? Okay. Dental health and teeth development. So maternal dental health plays a factor in babies' dental health. Okay. So if mom has poor dental hygiene, doesn't have dental insurance, can't have access to a dentist that accepts their insurance, then that can really factor into the infant also potentially having poor dental health. Of course, there's conditions that can be genetic too that play a factor into infant dental health too. From mom. Okay. Cleaning the teeth should start whenever that first tooth pops through or erupts. Usually it's the bottom 2 teeth that are the first. Okay. Then you'll see the top 2 middle teeth and then the bottom side teeth, lateral incisors. Okay. And then the top lateral incisors. That's kind of the usual progression through infancy for teeth. Okay. Fluoride can start to be used in toothpaste at 6 months of age. Okay. Prior to 6 months, if they have a tooth pop through at 4 months, just use that toothbrush. You can put a little water on the toothbrush, but until 6 months of age, no toothpaste. Okay. once you start using toothpaste, a teeny little like rice size toothpaste amount is fine. Okay. So your goal is obviously to prevent cavities or dental caries. So telling parents to not prop the bottle, because what happens is that milk just kind of sits on the baby's teeth. No milk in bed, no fruit juices at all, period. If they're going to do milk before bed or juices, make sure that they're brushing their teeth with toothpaste before they go to bed or after they're done with the juice. Okay. Pacifier use, of course, if they do not get rid of their pacifier by the time they're 2, that can start to affect their dentition. Okay. So kids through age 2 should have about their age minus the number 6 in teeth. So if they're 8 months old, they should have at least 2 teeth. Okay. So you say 8 months minus 6, 2. Okay. If they do not have any teeth at that time, it would probably be helpful to get that kiddo to a dentist to make sure that they can do a little quick dental x-ray to make sure that they have baby teeth. Very rarely people will be born without baby teeth. Okay.
You say if they're 8 months, they're supposed to have at least 2 teeth?
Yeah, so this is how you can kind of figure out up until age 2 how many teeth kids should have. So it's their age in months. So if they were 12 months, okay, you take that number minus 6, and so then that would be 6 teeth. Does that make sense? So at 8 months minus 6, they should have about 2 teeth.
Only reason I asked, my daughter's about to be 1 and she doesn't have any teeth. I see 2 coming in, but she doesn't have any teeth.
I know, and sometimes it just takes forever for them to pop through, and then they usually get like 4 at a time, it seems like. So, good luck to you when that happens. You might go through a little sleep regression, but yeah, so that's about how you can figure out how many teeth they should have. Okay, immunizations. So there's a lot of immunizations that happen throughout infancy. There's combination vaccines, so it's not like they get these all individually. Okay. So at birth, it is recommended by the AAP to do a hepatitis B vaccine across the board for all babies, even if mom tests negative for hepatitis B. The reason for that is because of the risk of exposure after mom has had her labs completed early on in pregnancy, like at her first visit is usually when those labs are done. Yes, one way hepatitis is contracted is sexually, but also through numerous other pathways, fluids, bodily fluids. Okay. So that's still recommended. And then the next time they get vaccines is at 2 months of age. Okay. At 2 months, they'll get, I'll let you guys write this down. Okay. Ready? So it's going to be diphtheria, tetanus, pertussis, polio, Hep B, Haemophilus influenza, which is this one here. Okay. Pneumococcal, and rotavirus. Now, I said that those are in combination vaccines. So the first 5 are all together. Most places. Depends on where you're going to the doctor, but most places have switched to the combination vaccine that has 5 in it. So that way they get 2 pokes and a drink. Okay.
Would you repeat those one more time?
Yes. So diphtheria, okay, tetanus, pertussis, polio, Haemophilus influenza B, pneumococcal, go back up here to Hep B, and rotavirus. So babies should get those at 2 months, 4 months, and 6 months. This is the classic AAP schedule that has been the AAP schedule for 30 years now. Okay. So they're getting the same stuff at 2 months, 4 months, and 6 months. And then also at 6 months, they can add their influenza vaccine. Okay. The first time they get influenza, the first season, the first time they get that vaccine, they get 2 doses, 1 month apart.
I have a question.
Yes.
How I know like this is like all for like our class, but I want to know your like personal opinion about immunizations on babies.
Yeah. So, I mean, I agree with the AAP. There's a lot of good studies that say that this is necessary. Okay. The interval, the timing, giving them with everything, that's all been studied. Okay. I've been doing this now as a provider for, let's see, 7 years. And I haven't ever had a kiddo have a severe issue. Okay. Now, fever, rash, fussy, that all has happened. But nothing like life altering. Okay.
Okay.
So,
Thank you.
yeah. So I think that vaccines are really important, and unfortunately, because people are steering away from them, there have been a lot of outbreaks which are concerning, and more concerning to me than, you know, poor science potentially. I just haven't, you know, if there was a study or something like that that had good backing and had a lot of evidence, then that would be different. But at this time, we haven't seen any of that. So the AAP, along with several other healthcare entities, are following those recommendations. Okay. So like I said, kids get the same thing at 2 months, 4 months, and 6 months. At 6 months, they can add influenza vaccine. Okay. Then they get some boosters. They get a break at 9 months. That's their next checkup, usually. And then at a year, there's several that they can get, and it depends on their clinic on which they will get. But they could potentially get the MMR, their last dose of their pneumococcal, their last dose of Hib, which is Haemophilus influenza. Okay. Their first dose of chickenpox, and their last DTaP, or diphtheria, tetanus, pertussis. Okay. Now, babies go at 12 months and 15 months, so most providers split those 5 vaccines between those 2 visits. Just kind of depends on where you're at practice-wise, which they do at what age. Does that make sense? Hep A is also done usually at a year of age. Okay. Next checkup is at 18 months. I know we're kind of into toddlerhood now. And usually they'll just get their second dose of Hep A at that visit. Okay. And then once they have their second dose of Hep A, they're done with their baby shots. Okay. And then they're done with routine vaccines other than a flu vaccine each year if parents want to do that until age 4. Okay. Any questions about vaccines? They do not get HPV and they do not get meningococcal until they are 11 years of age, at least. Okay. So I know that those 2 are on here, but they don't get those in infancy. Okay. Any questions about vaccines? No? I know I kind of read those off to you really quickly, but I would say just to kind of generally know, you know, that they're getting vaccines at those visits, and that at birth, it's recommended across the board for all babies to get Hep B. Okay. Okay, special health problems. So colic. This is where usually it starts between, I would say, 3 to 6 weeks, usually peaks about 6 weeks in infancy. Okay. So essentially it's abdominal pain that kind of comes and goes no matter what you do for babies. They're just going to be upset and fussy. Colicky babies, they're going to be fussy. Nothing is going to comfort them during this time. Usually making sure that they've been fed, they have a clean diaper. You know, you can try rocking them and shushing them, but a lot of times that's not going to be overly helpful. You just kind of have to wait through their, I call it their witching hour, like, you know, the couple of hours that the colickiness lasts. Now, some babies, colic can be triggered if they kind of have a dairy intolerance. Okay, so if mom is eating a lot of dairy in her diet, sometimes this will trigger colic to be worse. Okay, this is where you talk about, do you guys remember talking about the period of purple crying in your OB class? Yes? No? Maybe? So like when parents can get kind of overwhelmed and frustrated and they shake the baby. Remember that in your OB class? So this is when you kind of see that risk potential, is when they have a colicky baby. So the other important thing to teach parents is if they're getting overwhelmed with their baby, lay baby in their crib, shut the door behind them, know that they're in a safe area, and take a break. Okay, so that way they don't get too overwhelmed and make a poor decision. Okay, dystomias, parasomias, those are sleep problems that can occur in infancy. So dystomias, does someone want to tell me what dystomias means?
The irregular sleeping rhythm.
Yeah, so more like troubles falling asleep, staying asleep. Okay, good. And what's parasomia? Anyone? So parasomia is like sleepwalking, sleep talking, things like that. Whereas dysomia is more the troubles getting to sleep or falling asleep or staying asleep. Okay, so you can start to see those sort of sleep effects in infancy, towards the end of infancy usually. Okay, failure to thrive. So this is a growth failure. This is what I was talking about with infants. So if they're not 6 months or doubling their weight by 6 months, or what by a year, what should their weight do?
Triple.
Triple. Good. So if that is not happening, or they've not gone back to birth weight by 2 weeks of age, this is where that workup for failure to thrive comes in. So blood work is usually done, and you know, looking at their any metabolic conditions potentially. Okay. Obviously, if something is identified, then those interventions will be provided. But if there is nothing identified, then educating parents about, you know, feeding and waking them up to eat. You know, if they're failure to thrive, they're going to be needed to wake up to eat throughout the night. Okay. So you as nurses will kind of provide that education and that observation of those kiddos. They're also going to be coming in often for weight checks. Okay. Plagiocephaly. So you can kind of see this baby here has kind of an odd shaped flat head. I bet if you looked at the back, you could really see, you know, the asymmetry of the skull in the back. Now, what's going to fix this is tummy time. Okay. Being on the tummy holding their head up, not laying flat, worsening that flat spot. Okay. If they're doing tummy time really well and they still have plagiocephaly, then sometime a helmet has to be in place. Okay. Usually better to get that helmet in place by about 6 months of age because they don't have to wear it for as long, usually. Okay. Once that helmet's put in place, a lot of times that plagiocephaly resolves. Okay. Now, if it's put in place too late, then a lot of times there's not a whole lot you can do to kind of help mold the curve back to the skull. Okay. Tummy time is going to be really helpful. A lot of times if kids have plagiocephaly, so that flat spot, they also have a favorite side to turn to. So you'll see them get torticollis or shortening kind of the tightening of the neck muscles. So they're kind of stuck looking to one side and they can't turn very well to look to the other side. Those kind of go hand in hand. A good physical therapist can work with parents on kind of strengthening those muscles and also measuring for helmet. Okay. Okay, someone asked how late is too late for helmet correction. I usually say if they're older than a year, especially if that soft spot's closed, I mean, a helmet's not going to do really much at all. If they've started before a year, they might continue a helmet after the year of age, but a lot of times if it's not started in infancy, it's not going to be overly helpful. Okay. I mean, I have seen some kids get it later on, but they're usually wearing it like long term for quite a few months, and it doesn't necessarily make a huge difference in those kids, unfortunately. Oh, okay, diaper dermatitis. So this is really painful. I mean, it looks super painful. Think about if you had this, it would be very uncomfortable, especially if you were peeing and pooping in a diaper. Okay. So diaper dermatitis can be caused by multiple different things. Sometimes it's creams, lotions, detergents, things you're using to clean your wipes, your diapers. Sometimes those can cause kind of more of an allergic dermatitis. Okay. This to me looks yeasty. So, you see your kissing lesions, which is very reflexive of yeast. So those red areas are up against each other and it's like a mirror on both sides for the area of redness essentially. And then you have these pinpoint satellite lesions. This is very classic yeast appearance. So what do we do if they have a yeast diaper dermatitis? What are they given?
Nystatin.
Exactly, in a cream, okay, or an ointment, okay? You want to make sure you're telling parents when they use Nystatin that they keep using it for 2 to 3 days after it goes away because yeast is really sneaky, and if they stop as soon as it looks like it's better, then it'll come right back usually, okay? Sometimes you will see like an allergic diaper dermatitis happen if they have food allergies. So like kids who have, or like an intolerance, kids who get like loose poops with fruit intake or certain fruit intake, you might see a diaper dermatitis occur. So depending on what the cause is, you might need to be switching brand of wipes, you might need to be switching diaper brands or creams or lotions or soaps that you're using, or they may not need to eat, acidic fruits 3 times a day. Okay. Might need to back off on that too. But if there are any open areas, you worry about like a staph infection occurring. So a lot of times you'll do like an antibiotic ointment in those open areas of excoriation on a diaper dermatitis. And then if it looks like this picture, they should get a yeast covering medication like Nystatin. Okay. Cradle cap or seborrheic dermatitis. So this is really common. I would say almost all babies get cradle cap. Sometimes it will progress to their forehead or their ears, kind of the base of their neck. Just kind of depends how severe their seborrheic dermatitis is. So it's not like an overly problematic issue. But a lot of times it can affect that hair growth. Okay. Now, what is recommended to do is use baby oil or mineral oil, so a good moisturizer, onto their scalp. Cover it all up with that oil, and then use a soft bristle brush and kind of scrub their shampoo in with that soft bristle brush. And then let them air dry after you've rinsed the oil out really good, because otherwise they'll be really greasy and you don't want that. And then comb through with like just a regular baby comb, not the soft bristle brush. Okay. And you'll want to do that, tell parents to do that. They could do it daily or with any of their baths until those scales have kind of all come off. Sometimes in some kids, cradle cap is worsened by dairy formula or mom having a lot of dairy. Okay. Do not use olive oil or any of the like food oils, because that actually can worsen the lesions, as it kind of feeds them essentially. Okay. Okay. So risk factors for SIDS. So SIDS is a sudden infant unexplained death before the age of 1. So some risk factors are sleeping prone, so sleeping not on their back, cigarette exposure, being too hot while they're sleeping, respiratory infections. There is a slightly higher risk if baby is not breastfed. Okay. They're having no vaccines or late to vaccines. That has a slightly increased risk for sudden infant death syndrome. Typically peaks between 2 and 4 months of age, but like I said, the risk continues up until a year. Being male is also higher risk. Okay. And using a mattress that doesn't fit in that crib, or using bigger sheets than should go on the crib mattress. Okay. Okay. And ALTI. So this is a near miss SIDS, or something is triggered that, the death portion stops. So an ALTI is an apparent life-threatening event. Usually some things that can trigger ALTIs, acid reflux, sometimes can cause ALTIs in kids. So there's a form of seizure disorders that can cause ALTIs. I mean, there's a lot of different causes. So essentially what happens is there's an apneic episode, and then their brain is triggered, oh, hey, I need to breathe. And then that's where you see the ALTI instead of the SIDS. Now, obviously, if their brain isn't triggered to breathe in a SIDS, and then you progress to SIDS. Okay. So depending on whatever is causing that ALTI, which will be determined in the hospital setting, then that is kind of how the management happens. Now, you will see some babies after they've had an ALTI go home with an apnea monitor. So the apnea monitor, this will go off depending on the settings of the apnea monitor. A lot of times it's a chest piece connected to a big monitor. And if they have, pauses of breathing for longer than 20 to 30 seconds, it will alert. And then the thought is that it's loud enough, it will trigger the baby to, oh, hey, I need to breathe, and cause them to breathe. Okay. Okay. So like I said, the biggest risk is in infancy and in children across the board is motor vehicle safety. So motor vehicle crashes. So ensuring that babies are in their car seats, their weight-based, age-based, height-based, appropriate car seats. Infants, all of them should be rear facing across the board. Okay. The other concern is infant CPR. So you as a nurse, you will teach parents CPR if they don't know CPR already. Okay. And then of course, water safety. Babies, you know, can be in water with parents, but of course you run the risk of drowning. So making sure that parents are making safe choices with floaty devices and things. Parents need to be holding on to their infants in water. Okay. So that will be all anticipatory guidance type of teaching that you will do, along with your food teaching and your weight teaching and all of that. That's all infant-based anticipatory guidance. Okay. All right. Here's a question for you guys. Letitia is a breastfed infant who is seen in the clinic for her 6-month checkup. Mom tells the nurse she is sucking her thumb recently. Which of the following is the best nursing intervention? A, recommends that the mother substitute a pacifier for her thumb. B, assess Letitia for other signs of sensory deprivation. C, reassure the mother that thumb sucking is a normal reflex at this age. Or D, suggest that the mom breastfeed her more often to satisfy sucking needs.
C.
C. Yep, good. Reassure her that thumb sucking is normal. Okay. Now, of course, if mom wants to give her a pacifier instead of her thumb, she can sure try to do that. But a lot of times babies will still find their thumb for satisfaction. Okay. Okay. So look at your theorist again. Okay. Okay. So in infancy, Erikson is your psychosocial theorist. Okay. Erikson is developing a sense of trust versus mistrust. So infants will trust their care providers if they are being fed, if they're getting stimulated, if they're having their diaper changed, then they will develop trust. Okay, they know that they cry and parents come and meet those needs, or their daycare provider, or whoever's watching them. Okay, then those infants develop trust. If they're crying and crying and crying and they're not being stimulated and they're not being fed, they're not having their diaper changed regularly, eventually the crying will stop because they've already developed mistrust. Okay. So if they get stuck kind of in this mistrust, then you can a lot of times see more aggressive kind of behaviors happening in infancy into toddlerhood. Okay. So this is where they become very narcissistic. Now, toddlers are narcissistic in their own ways because it's always me, 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 right? But they will never grow out of that if in infancy they've been stuck in the mistrust category. Okay. Grasping at things, biting, hitting, all of that will progress if they stay in the mistrust category. So it's really important that infants develop trust in infancy so they can progress to the next Erikson step. Okay. Cognitive theorist. This is Piaget. Okay. Birth to 1 month is the use of reflexes. So the rooting reflex, you touch their cheek and they try to eat. You put your finger in their hand and they grasp. That's the sensory motor phase, which is birth to 1. Okay. The next section of sensory motor is 1 to 4 months. These are those primary circular reactions. So they're sucking their thumb on accident, and then they realize, hey, that makes me happy. And then they find their thumb again, and then they figure out, hey, that makes me happy. I'm going to keep doing that. Okay, so that's the primary circular reaction. Secondary circular reactions are where they're imitating you, they're playing. Okay. Okay. So a schema is a framework. So essentially what happens is they're gazing, they're looking, they're reaching, they're grabbing that rattle, they're picking it up. So these are all schemas that are kind of inputting and leading towards that reaction of picking up the rattle. Okay. And then they pick up the rattle and they hear it shake. Then they like the shaky noise, so then they keep shaking it. That's kind of how they progress their cognitive development according to Piaget. So that's all sensory motor phase from birth to 8 months. First step of Piaget. Okay. I said birth to 8 months. I meant birth to 18 months. I'm sorry. So sensory motor is birth to 18 to 24 months. And then at toddlerhood, they progress to pre-operational phase that goes through school age. Then concrete operations is school age kids, so 7 to 11. And then your formal operations are adolescents and on. We'll talk about those more in depth too. Okay. Developing body image. So this starts to occur, later on in infancy. By their first year of life, they should recognize that they are separate from their parents. Okay. Now, in order for them to realize that they are separate from their parents, they have to, oh, somebody's unmuted. Julie, I think maybe you're unmuted. Thank you. So they have to realize that they're separate from their parents. So in order for that to happen, they have to gain object permanence. Okay. So this should happen. This is another milestone that you guys should know. Okay. Really important. So this should happen by 10 months of age. This happens. So before 10 months of age, you put a ball in front of a baby, right in front of them, cover it up with a blanket. They think it's totally gone. Disappeared. They won't look for it. They think it's just gone. Magic. Okay. At 10 months, or when they develop object permanence, put that ball in front of the baby, cover it up, and they're going to grab for it. Okay. So they realize that that ball didn't just disappear. Okay. So that's really important to know. It's a very important step in the process, because if they don't have that object permanence, they don't realize that they are separate from others. Okay. Attachment, that is occurring all throughout infancy. If they're not attached in infancy or early on in infancy, then you'll see a lot of, delayed development, things like that. Separation anxiety, this is totally normal between 4 to 8 months for babies to have this. And then it kind of comes back in early toddlerhood, like 15 to 18 months. Usually you see it again. Separation anxiety, totally normal. Okay. So just let parents know, yes, we know that they've seen grandma 50 times, but they're going through their separation anxiety, and that's developmentally appropriate. Stranger danger, fear of strangers, usually that's by about 6 months. They'll hold on to parents. They don't want to go. They don't want to go somewhere else. Usually that peaks around 9 months of age. Okay. Language development, mama, dada, baba, those sort of noises occur, starting around 6 to 9 months of age. Okay. And then that language should just continue to develop. If babies are not talking at all by 18 months, so toddlers, if they're not talking by 18 months, then you get concerned about potential autism. Okay. And infants, as they're becoming more mature with their visual acuity and their auditory acuity and their kind of interaction, and they're staying awake for longer periods of time, their play should kind of continue to develop as well. Okay. Okay, do we want to go to talking about preschoolers, or do we want to do the infants Kahoot right now?
I do the Kahoot.
Okay. Otherwise, we can go through preschool and toddlers on the PowerPoint, and then do a combined Kahoot at the end. This Kahoot will just be over infants info. What would you guys like to do?
We can do the Kahoot.
Do the Kahoot now? Okay. Okay. Whoops. Hang on, let me stop my share and see if it'll. Okay, that link isn't not working. Let me use the other link. Sorry, guys. Do you guys have any questions about infancy before we start the Kahoot? No? Yes? I know that that was a lot of material. The first 3 weeks are a lot of material because knowing your developmental milestones, knowing your infant, normal, your preschool, toddler, normals, school age, adolescence. It's just a lot of information. So if you're feeling overwhelmed, it's a pretty typical feeling that most students are having. Okay. Just ask questions. Like I said, read your book. That will all be extremely beneficial to you. Okay. Let me pull this up quick. Sorry, Kahoots always kind of takes a long time if I don't have the infant specific one pulled up. I'd had the big combined one pulled up already. Oh my goodness. Okay, it's finally loading. Share my screen here. So in your exam 1 materials, your Kahoots, the individual Kahoots for each topic, so infancy will be there, and then also the big combined Kahoots will also be there, okay? Oh, here. No, for some reason it's not. Okay. So you guys should be able to join on Kahoot.it, I believe .com is what it is under. And then it'll pop up here with a game pin in just a second. Maybe. Yes, thank you, Grant, for answering. I answered that in lecture too, but yep, essentially after a year, it's not very beneficial for a helmet. Okay, let's see. Okay, here we go. Goodness gracious. Okay. So yeah, www.kahoot.it, or if you have the Kahoot app on your phone, it should take you here. Also, if you scan this QR code with your camera, it should take you right here too. Okay. Remember, stay on camera unless you're running quick to the bathroom or something, or running to go grab your phone now, probably because of you didn't expect to need it. Okay. There's a few of you guys left here to join. This is a part of class attendance, so make sure you're joining the Kahoot since this is what we chose to do. Okay. Is it letting everybody in? I know sometimes there's some issues with it. Remember to keep your cameras on. Okay. Alrighty, we'll go ahead and get started here. Okay, so like I said, this is just infant's information. So in general, an infant should triple their birth weight at blank months of age. 3 months, 6 months, 12 months, 15 months. Yep, good. 12 months, triple by 12 months, double at 6 months. Okay, thank you. Okay. An infant weight should blank by 6 months. Oops, I gave you guys the answer. Triple, double, quadruple, a little less than double. Double. Good. Okay, multiple select. Infant nutrition includes no honey for the first year, avoid finger foods until 12 months, introduce new foods every other day, no cow's milk until a year. And it was a multiple select, okay? Okay, I forgot to tell you guys this. This is where reading the book, because I can't tell you all the things with every PowerPoint presentation, okay? So this is where this comes in. No honey until after a year and no cow's milk, like plain cow's milk, until a year. Now, does that mean babies can't have yogurt or cottage cheese before a year or cheese before a year? No, they can have all of those things before a year. It's just regular cow's milk. They have to wait until they're 1. Okay. And remember, we said finger foods, they can start at 6 months. New foods every other day. We don't have to do that anymore, remember? Okay. Another multiple select. Infant nutrition for the first 6 months. Human breast milk, infant iron fortified formula, infant formula with DHA, lactose-free infant formula. Yes, good. So first off, lactose-free infant formula, they don't make lactose-free. It's dairy-based or it's soy-based or it's more broken down, hydrogenized than that. So then it doesn't have soy or dairy, which would be like Nutramigen. Okay. And the formula milks that they make for like toddlers, you don't do those in infancy either. Also, you don't have to do those in toddlerhood. Okay. So breast milk or formula. Okay. Iron fortified formula. Okay, another multiple select. Nutritional interventions for an infant include add vitamin D to breast milk. Formula must be iron fortified. Solid foods can be given at 3 months. And allow one solid food at a time for 4 to 7 days before adding. Yes. Okay. Now, this 4 to 7 days before adding, this is an old thing. Now, I think your book probably is still for your add one solid food at a time for 4 to 7 days. Okay. So as far as for HESI, this is what I would know. Okay. But that is an old recommendation. We've moved away from that. Okay. Books just take a while to re-update. Okay. So as you're reading, you'll probably see, okay, one new solid food, 4 to 7 days, wait, and then add the next. Okay. Vitamin D with breast milk doesn't have to have vitamin D with formula. Okay. And formula should be iron fortified, and that's because of that anemia that occurs in infancy. Okay. Perfect. Okay. An 8-month-old infant should be expected to perform which fine motor skills? Building a 2-block tower and grasping a rattle, using pincer grasp and placing objects in a container, place objects into a container and walk with one hand held, grasp a rattle and use crude pincer grasp. Okay. Okay. How old are infants when they're putting things in a container? Do we remember back at the beginning of lecture?
A year?
Yeah, close to a year, right? 11 months. Okay. So at 8 months, they shouldn't be expected to do that yet. The other thing is the pincer grasp. So you hear crude pincer grasp in the other question. That's when they're using like their forefingers to sweep it up and grab it. Fine pincer grasp is pointer finger and thumb. That's what's happening about 10 months of age.
It was 7 months that was taking out objects of a container, right?
Yes.
Okay.
Yep. Yep. Good. Okay. Which of the following is an example of fine motor skills in infants? Crawling, grasping small objects with thumb and forefinger, rolling over, jumping up and down, which is a fine motor skill. Yes, good. Crawling, rolling over, and jumping up and down. What are all of those? What category is that? Gross motor, right? Fine motor are more those fine controlled movements. Okay. So like hand gesture movements. Okay. Good. So grasping, that pincer grasp is a fine motor. Okay. Which is the correct order for development of gross motor skills in infants? Holds head up, rolls over, head steady with sitting, stands with help, stands. Holds head up, head steady, sitting, roll over, stands. Roll over, head held up, head steady, stands with help, stands. Or none of these. Okay. So the red one, holds head up, then roll over, then head steady with sitting, okay, standing with help, and then standing. That's the typical progression, right? Because we said head at cephalocaudal. So head development first, right? And then it kind of progresses to our core, which goes along with sitting and crawling, okay? And then legs, so standing with help, and then standing, okay? Good. Questions with that? Now, not every baby goes through that exact sequential process, and that's okay too, as long as they're accomplishing their development by, the later end of the range. Okay, at what age can an infant typically sit unsupported? 6 months, 7 months, 8 months, or 9 months? Eight months. Sitting unsupported, 8 months. Some sitting with support. So like parents kind of helping hold them up. That might start about 6 months. But sitting without support is 8 months. Okay. Good. You guys want to keep doing these, or do you want to go back to the PowerPoint for toddlers?
PowerPoint for toddlers.
Okay.
I know my last 3 or 4 answers haven't even come through.
Oh, really? Okay. Sorry. At
That's
what
all right.
age does an infant typically start rolling? We'll do this one. 2 months, 3 months, 5 months, 7 months. I know Kahoot isn't without its issues at times. Okay. They should be rolling over at 5 months. Back to belly first. Okay. And then belly to back. Okay, let's get on out of here and we'll do the.
These are posted on your announcement page, correct?
Yes. Yep. Yep. And I'll double check that I posted the separate infant one on there. I know for sure it's posted under the exam review with all of the separate ones. But it should be posted in the individual weeks as well. Like I said, I'll go back through and double check. Okay. All right. Let me get the screen shared again here. Okay. Go back here to the PowerPoint. And we'll talk about toddlers. Okay. Are you guys able to see that? I'm going to switch it to slideshow view here. Okay. You see that? Yeah? Okay. Oh, darn it. It kicked me out. Sorry, we have to go all the way to page 32. Okay. Whoop. Okay, I got too click happy here. Okay. So, toddlers. So, Jerry Seinfeld said having a 2-year-old is like a blender without a lid. Totally appropriate comment about toddlers. The terrible twos, right? Sometimes the terrible two starts at 12 months and it doesn't go away until they're 4. But so your toddler age is from 12 months to 36 months. So 1 to 3 years of age. Okay. So they're very much exploring their environment. They're pushing the limits. They're very self-centered. So you're going to see a lot of temper tantrums. They're going to be saying no because that's their favorite word. They have a lot of negativism. So they're no, no, no. Okay. Mine, me, self-centered, narcissistic. Okay. Now you're going to have slower weight gain. 4 to 6 pounds a year is pretty expected. Birth weight should quadruple. Okay, so they should be 4 times birth weight by 2.5 years. Height is about 3 inches a year. The legs are going to be longer than their trunk. Up until toddlerhood, their trunk is mostly making up their body length. Okay, more of a step-like instead of a linear growth. Okay, so a slower growth in toddlerhood. Now, this is crazy to think about, but at age 2, you were half of your adult height. Isn't that crazy? That's how much growth happens from birth to age 2. Okay, their head is the same size as their chest circumference. Before this, head is much larger than their chest. Okay, maturation of body systems continue. You know, we get into potty training. They can hold their bladder. They know that they need to go potty. Their body temp is regulated at this point. Their immune system is fighting off all sorts of things from daycare, upper respiratory stuff, ear infections, strep throat, or tonsillitis. Okay. Their biggest defense for any immune system is your skin, right? So if their skin is intact, that's their first defense. Gross and fine motor development continue developing. So you're going to get that more refined coordination between ages 2 to 4. So they're not going to look like little intoxicated people walking around like they do, you know, early on in toddlerhood. Their later toddlerhood, they're going to be walking really efficiently. They're going to be running. They're going to be more, having more dexterity. So they're going to be throwing balls. They're going to be kicking. You know, they're going to be coloring more organized ways. Okay. So that's all progressing through toddlerhood. Their visual acuity is about 20/40, which is totally normal for toddlers. Okay. Their depth perception is still developing. So some like falling is pretty typical. The risk is falling from heights in this age group. Okay. Hearing, smelling, taste, touch. Oops, sorry. That's still developing. You'll see them become picky eaters. They don't want to try new foods, whether that's from their friends at school or daycare, excuse me, or just their typical toddler diet. Okay. They're using their senses to explore their environment. So sensory play is really good. So water play, sand play, playing with slime, which is my arch nemesis at my house, but you know, little kids love to do that. Okay, psychosocial development. So this is Erikson. Okay, Erikson is your psychosocial developmental theorist. Autonomy versus shame and doubt. So they want to do things themselves. Me, I do all of that. They want to do it themselves. If they're not allowed to have some autonomy and kind of make their own choices, somewhat, right? Appropriate choices, then they'll have shame. Okay. Ritualization provides a sense of comfort. So if they know what their routine is and what typically happens, they feel a lot safer. Okay. And you'll see them become more autonomous. Okay. Their id, their ego, their super ego, their conscience, it's all about them. Okay. And like I said, they have that negativism. So no, no, no. Okay. Cognitive development, this is sensory, motor, and pre-operational, because remember, sensory motor stage goes until about 2 years of age. So this is that object permanence. Okay. They're learning based on their environment. Okay. Pre-operations, that's from age 2 to age 7. So that goes through preschool age. This is when they're using symbols and playing in pretend play and kind of learning how to logically reason, or learning how to have some reasoning. It's not always logical. Okay. Still egocentric. So still all about me in pre-operations. Okay. So here was our early sensory motor, remember, stage for cognitive development. Here's where we start toddlerhood. So I drop my milk off of my high chair, my mommy picks it up or my daddy picks it up, and then I drop it off again and see if they'll pick it up again. And then it turns into a game, right? So that's that tertiary circulatory reactions. So this is that 12 to 18 month piece, up to 2 years. Okay. Here's Erickson again. We kind of already talked about this, but allowing them to kind of make some choices, put their clothes on if they can, allows them to be autonomous. If you're like, nope, you can't do that because we don't have time, and every time you don't have time, and so you don't allow them to do it, then they'll be shameful. Okay. Development of gender identity. This is formed by about 2 years of age. Okay. Typically, toddlers understand the gender roles. So most females will play more typically with the girls, or like dolls, do more girl, mommy kind of things. And the boys will tend to do more daddy sort of things. So like if daddy's a farmer, we're going to farm. Okay. That's how you'll typically see their play. Okay. Exploration of the genitalia in toddlerhood, they're potty training, they're figuring that out. So that is definitely something that can occur sometimes in inappropriate settings, but trying to be accepting of that as a parent, and trying to talk with the kiddos about, okay, we do that in privacy. Okay. But know that that's a pretty okay thing, normal developmental thing. Okay, separation, they totally understand. They are separate from their parents, from other friends, and they start to want to express themselves in their own way. Okay, they might have some transitional objects, so they might have things like teddy bears or blankets that they like to keep for like kind of a support system. Language development, there's a huge amount of language development throughout toddlerhood. At 1, they should be saying 1-word sentences. By 2, they should be using 2-word sentences at least. Okay. By 2, they should have about 50 words that they're saying as well. If they're not meeting those milestones, then they need to go to speech therapy. Okay. Personal social behavior, developing some sense of independence, feeding, dressing, undressing, playing, brushing teeth, things like that. Okay. They are very strong-willed. And then you might get the blender reaction without the lid. Okay. Some volatile temper tantrums. Okay. Play. Usually it's parallel play. So in toddlerhood. Okay. So 2 kids are playing next to each other. They're not talking to each other at all, and they're playing 2 completely different things. They just happen to play sitting next to each other. That's parallel play. Okay. Imitation play, they see mommy or daddy playing with a doll, feeding their baby sister, so then they'll imitate that with their own doll. Okay. Tactile play, that's kind of that sensory pleasure play. Okay. Toilet training, they have to have the 3 signs of readiness. So dry for 2 hours, be about 2 years of age, and then typically dry overnight. Okay. Most kids are ready about 19 to 24 months of age. Physiologically, they could do it at 18 months. Okay. But doesn't mean that they're ready. Sibling rivalry, of course, that's something that you start to see in toddlerhood because they're me focused. Okay. Temper tantrums, you see more often around bedtime. Okay. Negativism, they want to be autonomous. Regression. So if they're stressed out at any point, new baby's born, they were totally potty trained, pretty independent little kiddos, new siblings born, now all of a sudden they're no longer going potty on the potty. Pretty typical form of regression. Promoting optimal health. So still good, healthy diet is encouraged, good variety of diet. But like I said, because they become that toddler picky and they mostly want snacks because they're not wanting to slow down long enough to eat a full meal, you'll see that physiologic kind of anorexia happen. Okay. So following the dietary guidelines, making sure that they're doing whole milk. If they're not doing whole milk, they might need calcium and vitamin D supplementation. Protein is really important. Now, they don't need a crazy amount of protein like us adults, but making sure that they're getting an adequate amount of protein is also pretty important. Okay. Sleep, this is where you can see some of those parasomnias. Okay. So sleepwalking, sleep talking, things like that. Okay. A lot of times sleepwalking and sleep talking can be connected to low iron in infancy, or excuse me, in toddlerhood. Dental health, regular dental exams. So every 6 months after 6 years of age, when they have pretty much all of their childhood baby teeth, they need to be flossing. Okay. They also have good dexterity by 6 years of age to be able to floss themselves. Okay. Fluoride is important in preventing cavities. So doing fluoride toothpaste, have them spit it out when they are done with brushing. Okay. Early dental caries in childhood can lead to, poor dental health. So ingestion, it becomes more of a concern in toddlerhood because they're able to walk and climb on things and get access. Okay. Toddlerhood. So at age 1, all little kids should have a lead level to check for lead poisoning. This is a universal recommendation. If their lead level is elevated, then they may need chelation, which is what's happening in here. In this picture. So essentially their lead from their blood is filtered out through the machine and then fed back into them. Prognosis with chelation is pretty high, that they'll eliminate the lead from the blood. Now leads have to be like greater than 50 usually for chelation to happen. So it has to be a really, really high lead. The highest lead level that I've ever seen was 25. And then in that kid, we found out that they were playing with some old cars at grandma's that had lead paint on them. So just trying to figure out kind of what potentially is the cause and eliminating that cause. Mercury poisoning, you don't see that happen as often since our thermostats are no longer mercury, within the thermostat. Most of them are no longer like that. So that's a little bit less of a concern. Okay. Ingestion, more ingestion of medications are the concern in or household cleaners, foreign bodies, any of those sort of things are risks for ingestions. Making sure parents have poison control number. Okay, so parents need to call poison control first as long as their kiddo's stable. If their kiddo's not stable, they need to call the ER for 911 first. And then poison control. Okay. Sometimes they have to have their like Epicac given to pump their stomachs to try to make them throw up. So that way they throw up the object. It just kind of depends on whatever the substance is. Okay. And then obviously the goal is to make sure that that doesn't happen again. So have access, meds and things locked up, household products locked up or somewhere high where kids can't climb to get them. Okay. Drowning is a big concern. Once again, still motor vehicle safety. Okay. So the best thing for kids to do is ride rear facing in their car seats until they max out height and weight requirements on their individual car seats, which varies per car seat. Okay. So rear facing until they max that out, and then flip to forward facing until they max height and weight out on that as well. Okay. Burns, because they're curious and they're grabbing hot pans off of stoves and such. Okay. falls, suffocation, aspiration, bodily harm from, pulling themselves up on the TV stand, pulling the TV over on top of each other, on themselves. That's another risk. Okay. Like I said, back seat, rear facing until 2 years of age. In a car seat, straps should be snug. In the center seat of the back is the best spot for them. If you cannot do that, then that's fine, but somewhere in the back seat. Car seats do expire usually 6 to 10 years from the date of manufacture. So you'll just have to look at that on the car seat. Okay. If car seats have been in a wreck, if they've have any pieces that are broken off or taken off, then they're no longer considered safe and they need to be replaced. The other thing is I've been seeing a few counterfeit car seats, which has been a new issue lately. A lot of them have been ordered through like Amazon. So they might have like no top 5-point harness piece, like buckle piece, or like really thick straps, or there's just a few kind of different, like they don't have the warning, like the weight and height and things on them, like other car seats do. So making sure that they're getting a not counterfeit car seat as well. Okay, gross motor development and toddlerhood. Refined coordination occurs when? Between 2 to 3 years of age, okay? The fine motor development, so that improved manual dexterity occurs when? (12 to 15 months of age, okay? And then throwing the ball occurs by 18 months. Okay? All right, that was really quick about toddlers. Do you guys have any questions? If you do, go ahead and unmute really quick.
I did have a little question, but it's not pertaining to toddlers.
Oh, okay.
On the quiz after class, is there any way that we could stay after for a little bit and maybe review that?
So the review that I typically do is like what we did at the beginning of class. We can't go through like the specific questions and talk about which ones individually you missed, but kind of just the most commonly missed, like we talked about at the beginning, like remembering that we triple birth weight by a year, and that sort of thing. So if there was a particular general question that you had, then we can go. We can't, like I said, we can't go through the question itself, but like the generalization of the question we could talk about at the end.
Okay.
Okay. Kind of like just with exam reviews, like if you want to meet after an exam, we can't go over the exam questions themselves, right? But we can go over concepts. Okay. All right. Preschooler and the family. We've got about 15 minutes left. Okay. So preschool period. This is from age 3 to 5. Think about when most kiddos are in preschool, around age 4, right? So age 3 to 5. So they are getting ready to go to school. Huge lifestyle change for them. Okay. Something that's really beneficial is reading to children daily. This is not just to preschoolers. This can start in infancy. It really helps with language development. Okay. Cooperation. They start to work with other kids their age. Usually it's really beneficial to have a good attitude towards school learning. Okay. You don't want to have a negative attitude towards school learning, because then you're kind of setting them to also, kind of have that negative thought. Okay. They're increasing their attention span and their memory over the preschool time period. Okay. Your physical growth is going to slow and stabilize. Most preschoolers will gain about 5 pounds a year. So that's a little slower than the 3 pounds a year. Or excuse me, than the 6 pounds a year that are typically happening, 6 to 10 pounds a year in toddlerhood. Okay, height is going to still be about 2.5 to 3 inches a year, which is a little slower than toddlerhood. Okay, body systems are essentially mature and they stabilize. Okay. Now, of course, if there's stress or change in that kiddo's life, there's gonna be some adjustment of those body systems. Gross motor, they should be really fine, like coordinated with their running, walking, climbing, jumping. That all should be really well established. Their hand-eye muscle coordination should be starting to develop, and they're becoming better at dressing and drawing and coloring themselves, or coloring. Okay. Now, psychosocial development. This is Erickson. Again, remember, this is initiative versus guilt in toddlerhood. Okay. So your biggest goal is to start taking initiative. Okay. Learning right from wrong. That's the moral development starts to happen here. Right from wrong. If they're not able to take some initiative, then they might have feelings of guilt. They might start to have anxiety. They might start to, have some behavioral regressions or refuse to do things because they're feeling guilty. Okay. Cognitive development. This is where the readiness for school starts. Okay. Typically between ages 5 to 6, preparing for kindergarten. Okay. This is Piaget. Positive attitudes towards learning, reading to them, getting them out, socializing with other kiddos. Okay, so this is that pre-operational phase of Piaget, which is age 2 to 7. Okay, then broken down from there, it's pre-conceptual, which is age 2 to 4, and intuitive thought phase, age 4 to 7. So we're shifting from egocentric, self-centered to more socially aware. Okay. That magical thinking starts to develop now, so that pretend play is happening during this time. Okay. They do not understand a concept of time very well during preschool age. Now, you might be able to say, when we wake up, we have breakfast, and they know, okay, when I wake up in the morning, I have breakfast. But if they wake up in the middle of the night and they come downstairs, they might think it's time for breakfast. Okay. Moral development, this is Kohlberg, so pre-conventional or pre-moral level. So they're learning a basic moral judgment. So you get punished or you get a reward based on if you're making a good choice or a bad choice. Okay. Very black and white, concrete. They're not understanding a lot of abstract things. Well, they're not understanding abstract things at all. Okay. So they're starting to identify racial differences, more appearances, depending on their family. They may have some biases there as well, potentially starting at this age. Okay. So kids' boundaries with their bodies are really poorly defined in preschool age. So they might think that if their skin gets a cut, all of their blood's going to leak out from the cut. So they have a really hard time understanding, or like if they like break a bone, their bone, like all their other bones are going to break, things like that. Okay. And intrusive experiences like having a blood draw or getting a shot, those are extremely frightening to them. Okay. Spiritual development. So this is usually in preschool age is when they kind of start to, if they have a family that's spiritual or religious, they start to learn about those religious practices and kind of start to understand some of that, the spiritual development. Now, if kids get sick during preschool age, they might think it's because they did something naughty, like, they said a naughty word, or they hit their sibling, or they took something from their sibling, and then that they're being punished with having that illness, or, that broken bone or whatever happened from their higher power. Okay. Children have in preschool age a strong attachment to the opposite sex parent, but they identify more with the same sex parent. So they If it's a little girl, like I said, they'll dress like mommy, they'll do things like mommy, but they really are attached to daddy in preschool age, and vice versa with kids with their mom and wanting to be like dad. Okay. Sexual exploration, like things like masturbating or being curious about touching their body parts, that starts to become more pronounced. And they might start questions with questions about, how babies are made and things. Okay. They're starting to realize, like I said, they know that they're an individual, they're separate from others, separation and fear that has resolved. Okay. Guidance from parents still very much needed, and still very secure with some familiar objects and routines. Okay. If kids are having a lot of fears, a lot of anxiety, a lot of kind of fantasy sort of things that seem overly typical of the typical kiddo, play therapy can be beneficial for that. Language is becoming more sophisticated. Vocabulary is hugely increased from age 2 to age 5, and the complexity of language also is increased from age 2 to 5. Instead of saying me, my, they start using I appropriately. Okay. Ritualism, negativism, this has resolved most of the time in toddlerhood, in preschool age. They're dressing themselves. They're wanting to make parents and others happy. Okay. They're starting to internalize the family standards and their cultural standards. Okay. And they may also start pushing the boundaries of the family conduct. Okay. Okay. Associative play. This is happening in preschool age. Okay. So associative play is they're playing a game. So they're building Legos together, but they don't all know all the rules and they don't all want to build the same thing. Does that make sense? So they're playing together, they're interacting, they're all playing with the same material, but they don't want to do the same thing with that material. Okay. Imaginative play, this is where you see a lot of imaginary friends. Okay. Dramatic play, we're playing something that we witnessed. Okay. And mutual play, we're playing with our friends. Okay. So if kids are asking questions about, how babies are made and things, find out first what they know or what they've heard. Make sure you use the correct anatomic words for their private areas. Okay. That's really important if they're being sexually abused. Okay. Be honest with them. Don't lie to them. Okay, like we said, masturbation and exploration is pretty common by around age 4, and we just want to talk with them about doing this in private. Oh, somebody's unmuted, I think. So in preschool age kiddos, there's a lot of fears. So fear of being left alone, fear of big dogs, ghosts. Some kids will have fear of, like, if they've been really shamed about potty stuff or masturbation, they'll have concerns about, their penis getting chopped off, just really like out of characteristic type of fears. Okay. Objects or people are associated with pain. So like you as the nurse in the clinic, you're very much associated with shots or blood draws. So they will start to not like you in this preschool age phase. Okay. If not a little bit before. Speech problems. So your critical speech period is between 2 to 4 years of age. Like I said, speech, you can start to see stuttering, stammering, and early intervention is super crucial in speech development. Sleep inactivity, so nightmares, night terrors, those can start to happen. Those are some of those parasomias that we talked about earlier. Okay. Might start to have some resistance to going to bed starting in preschool age kiddos. So one way to kind of encourage consistent bedtime is being consistent with that routine. Okay, doing sort of a slow down activity before bedtime, not having those kids on screens right up until they're going to bed. No screens actually are recommended under age 2. Okay, injury prevention, they are starting to ride bikes or tricycles. So making sure that they have their helmets on or other protective equipment, like if they're roller skating or something like that, make sure that they have elbow pads, knee pads. Okay. Still motor vehicle accidents. But since they're starting to walk themselves and run around themselves and ride bikes and things themselves, you start to see more pedestrian versus motor vehicle accidents in this age group. Okay. Still number 1 cause of injury, motor vehicle accidents. Okay. So you might see some questioning of previous teaching of parents. Okay, they're seeing what their other kids and their class parents do or allow, and they start to question if that's okay. Okay, they're starting to prefer peer companionship versus parental. Okay, but parents are still very much the center of these kids' lives. Okay. Communicable diseases. Like I said, with the decrease of vaccines, there are a lot more communicable disease risks like varicella, so chickenpox, and MMR. With the measles outbreak that's happening in several states. So making sure that these kiddos get their vaccines to prevent disease and prevent the spread of disease. Okay. Hand washing also, and reducing risk of cross-contamination. Pink eye or conjunctivitis. This is pretty common in this age group. Those moist compresses and antibiotic eye drops if it's bacterial. There's also viral and allergic conjunctivitis. So those aren't as infectious as bacterial. Okay. Stomatitis. So this is what's going on in this period. So they get little wounds essentially through their GI tract. It can be internal as well. So down the back of their throat. A lot of times it's from strep or staph. So impetigo is another thing that you can see in this age group. So that's typically viral, but a lot of times they need to have like an antibiotic ointment provided. Pain relief, figuring out what caused it. Parasites, they're eating dirt and things under their nails, itching their bottom, and then putting their hands in their mouth. So enterobiasis. So pinworms is probably the most common parasitic infection you see, and you have to get a pinworm, like an antiparasitic for Giardia and for pinworms. Okay. The whole family needs treated if one kiddo has pinworms. Okay. Of course, we have to talk about neglect. So physical, emotional, abuse signs. Okay. So physical neglect is deprivation of food, clothing, shelter, medical care, or education, or supervision. Okay. Emotional neglect is, of course, just the lack of attention, nurturing their emotions or affection. And then emotional abuse is destruction of their self-esteem. Okay, so that's child maltreatment. Okay, physical abuse, this is going to be child abuse, right? So most common is head trauma in preschool age kids, still trauma. Munchausen's by proxy. So this is where parents may be saying that their kiddo has a medical condition, but they do not, but the parent may be doing things to induce kind of medical symptoms. Okay. So looking at risks or things that may predispose kids to abuse. So parents being abused themselves is a risk. Parents of lower social economic status, that's more of a risk. Characteristics of the child. So a child who is more difficult to deal with, they're at higher risk for abuse. And then if they're having a lot of environmental changes, so changes in their environment. So they're moving around a lot. They are with multiple different care providers. Things like that are more risk for abuse as well. Okay. Okay. We are at 4:40. Are you guys still with me? Or are you totally overwhelmed and wanting to stop? Totally.
Professor, I thought we were leaving early.
Yeah.
Overwhelmed.
Yeah. So it's 4:57 is the actual time. So I just wanted to finish the page that I was lecturing before I said, okay, it's 3:37, so people could leave. Okay.
Huh?
For your full
Okay.
attendance. Okay. All right. So those of you that wish to leave can leave. I can keep lecturing for the next 10 or so minutes here if you would like.
Thank you.
Yep. And then remember, next week you are with Professor Go again. Okay. And you'll get an announcement with that too.
Bye. Thank you.
Thank you.
Yep.
Nice
Thanks.
week. Bye-bye.
Yep, you too. Thanks. Okay. Does anyone want to stay on for the last few slides?
I'll be staying on.
Okay. Are you guys
I'm still on.
Okay, you guys are all gonna stay. Okay, we only have a couple slides left even, I think. I was just trying to find a stopping point instead of stopping in the middle of a slide to tell you guys it was okay for you to log off. Okay. So, let's see. Okay. You guys see that there? Oh, let's see. Switch. Okay. Now you should be able to see it. Oops, sorry. So you as a nurse, you are going to be a mandatory reporter, which means if you have concerns that a child is being maltreated, whether it is neglect, physical abuse, sexual abuse, emotional abuse, any of that, you have the, like you are mandated, you have that mandate to report that concern, okay? Whether you know absolutely for sure that is happening, as long as you're doing a good faith report, you are under the impression that that kiddo is experiencing mistreatment, then you have the coverage typically to make that report. Now, if it goes unfounded, then it's unfounded, but at least there is a documentation that you called and made that report as a nurse, that you were concerned about this kiddo's safety. That way down the road, if there's another call from school or from you guys again, it's kind of already laid the groundwork that there were some concerns, you know, years ago. Okay. Obviously you want to keep that kid safe. So if they are in immediate danger, you need to keep them in your clinic or in your hospital setting or in the ER and have, and or if they're at home and you know that they're, there's concerns for their safety, you need to be calling police. Okay. Now, you also need to be figuring out who's the abuser and keeping that kiddo away from the abuser in that process. Now, if you're not sure, that's okay. You can just call and make your report, and that's kind of DHS's or CPS's process is figuring that out, along with, police if they need to be involved as well. Supporting the family and the child through that process if abuse is happening, outside the home in a daycare setting or something like that. Parents and that child are very much going to need support. If the child has been admitted because of their abuse injuries, then obviously planning for discharge, just like you do with any other kiddo. That starts basically as soon as they're admitted. Okay, plans for discharge. And then, of course, preventing any future abuse in that kiddo's life.
Is this something you only report once? Like, let's say, like, if you're like a frequent flyer, like the patient's like a frequent flyer, like, do you report it every time? Or like as a school nurse, you report it every time they come to you?
So if you're continuing to see those signs, like ideally, so if you call and make a report, okay, this kiddo seems, they're showing up late to school. Say you're the school nurse. They're showing up late to school all the time. They're in dirty clothes. They don't seem like they're being taken care of well. You make that call. DHS does or CPS or whoever does their investigation. It's unfounded. Okay. Then the next week they keep coming back. Maybe they're more dirty or they're, later more often, then absolutely call again. Sometimes it takes, numerous phone calls for there to be action. Unfortunately, it's just kind of a broken system. But yeah, if there continues to be signs of abuse in any form, then I would be calling again. I know it seems silly that you have to call a gazillion times, but unfortunately, that's kind of how the system works. It's broken in that way. Okay. So yeah, I don't usually just call once and then stop. Now, if I call once, they do an investigation and things get better, then obviously you don't continue calling. But if you're continuing to see the same signs, then yeah, I would call again. Okay. Okay, question. Parents tell the nurse their 3-year-old daughter and a male cousin of the same age were inspecting each other closely as they use the bathroom. Which of the following is most appropriate response by the nurse? Punish the children so this behavior stops. B, neither condone nor condemn the curiosity. C, allow the child unrestricted permission to satisfy their curiosity. Or D, get counseling for this unusual, dangerous behavior. What do you think? Sorry, did somebody say something?
Is it B?
B. Yep, good. Try not to make a huge deal about it, but we can talk about, once again, private time, right? Our private parts are private. No one should see them. We should keep them to ourselves. Okay. But try not to make a huge deal about it, because a lot of times then kids just become more curious. Okay. All right. That's the end of this slide show. Any other questions that you guys have? No? I know that was a lot. Like I said, the first couple weeks, it's like, holy cow, this is way too much information. But I promise once we start getting body systems down, things will smooth out some. But read, okay? All right. Holler if you guys need anything. And have a good rest of your week, okay? Don't forget to do your discussion post number 2.
Thank
Thank you
you.
very much.
Yep, you're
Thank
welcome.
you.
Yep, see you guys later.